Dr. Dan Fazio is a chiropractic physician with a 15-year practice rooted in functional medicine. I should tell you too, I have a regular doctor, but Dan is my wellness physician and has been for years. Functional medicine is the art and science of exploring the root cause of imbalances that lead to illness states. His mission is to care for patients by helping to control risk factors to their health and well-being. Today we will learn how we can stay healthy while getting out there.
Thank you so much. Thank you, everyone. So excited to be at my favorite gathering of the month, and that is the absolute truth. So I'm very excited to talk today. Staying Healthy is our series that I'm lucky enough to be presenting for you, and today's topic is the thyroid gland. So we'll just start with some basic anatomy here. We're not going to go too deep. Nobody get nervous. The thyroid itself is a butterfly-shaped gland that exists right underneath your voice box. And it has a central portion that's real narrow. It almost looks like a bow tie that's really exaggerated. The central part's called the isthmus, and it's tight there. Then we have a left and right lobe. But the thyroid itself is actually palpable. It's part of our endocrine system. And if we think of the endocrine system, these are the chemical messengers that help to control processes in the body. We really have two different centers that control function in the body. The first is our nervous system, which responds instantaneously in a fraction of a second. Think of the longer term actions that need to be done in the body, and those are controlled by our hormones secreted by the endocrine system. So when I mention the thyroid, we think this is a relatively small gland. It's easily palpable. If a patient has a question about the health of their thyroid, as a physician, I can get hands-on and just feel. How's the right lobe feel? How's the left feel? Is there a change in that structure? And we'll talk some of the basics here, and then I hope to answer any questions you might have. So let's get rolling here. So a butterfly-shaped gland, like we talked about, located front of the neck just below the Adam's apple. And despite its size, it plays a huge role in your metabolism. When we think of metabolism, we often think of burning energy, how fast our body burns energy. And that's very appropriate. The process known as metabolism is actually the exchange of energy in the body, the energy that fuels all cellular processes, including cellular respiration, which is the process of exchanging oxygen, carbon dioxide, metabolic waste products. So what I want you to read is incredibly important. Even though it's a tiny little gland, it's unbelievably important. And we know its importance is so deep-reaching because almost every cell in the body has a receptor for thyroid hormone. Let that settle in, whether we're talking about the liver, the kidneys, the spleen, pancreas, bone, all of the cells in the body have receptors. So we know that. It's like a lock and key relationship. A receptor is the lock and receives the key, which is the thyroid hormone. So let's talk a little bit about this and why it might be important to everyone in the room. Thyroid medication, just to talk about prevalence, is in the top 4. If we look at medications that are prescribed, we're not talking about anti-inflammatories or things that are taken to control a headache, not over the counter. We're talking about prescription drugs. There's a quad that makes up the most common prescribed drugs, and thyroid is on that list. Oftentimes, pharmaceutical sales individuals who are charged with delivering and educating providers, if they represent a thyroid drug, it's one of 2. They usually have 2 products. Their entire job is built around that. That's how prevalent this is. So anyway, back to it. I'm going to use a term called the basal metabolic rate, or BMR. All that means is metabolism. So when you hear that, BMR, think, how are the processes going in the body that have to do with energetic exchange, everything, and this is measured by the BMR. Now, the way we really measure someone's BMR clinically in the real world is have them do a temperature series, because the temperature that your body's emitting is our best measure here. But that's not how we determine if the thyroid needs help. So we'll talk a little bit more in depth there. So let me give you just a little bit. We talked anatomy, you know where it's at and what it looks like. Now we're going to talk a little bit of the physiology, how it actually functions. There are 2 different hormones made by your thyroid, T3 and T4. Pretty creative. Here's how they're named. T4 is made up of 4 molecules of iodine. If you think of the thyroid, and you've heard before that iodine is important for the thyroid, it's because it's crucial. It's the building block of the functional constituent of the hormone. So T4 is 4 molecules of iodine. Thank you, Mark. T3 is when the body subtracts one of those away. Now, why would we have 2 different hormones? Well, it's because one of them is really shelf stable. T4 moves around. Think of it as a beverage 4-pack. It's all packed up. You're not going to consume that beverage, but you can carry it anywhere you need to go, and it'll stay together. Once you break that 4-pack, strip away one of the iodine molecules, then that T3 is ready to be used. So what your body really runs on is T3. But in order to get it where it needs to go, you need the shelf-stable version. So if you're ever having your thyroid tested, we'll talk a little bit about, in an upcoming slide, what is tested. But I want you to understand that these have different meanings if you're looking at your level of T4 versus T3. Because the T4 circulating, we want that to be at a certain abundant level. Not too much, not too little. But it's not really able to be used by the body until it converts to T3. And that's a process known as peripheral conversion. That's where it gets really interesting, because that peripheral conversion process is dependent on a lot of things, including your liver and digestive system also. So the plot thickens. All right, so what the thyroid regulates? Everything. But just a brief list: how fast your heart beats, how deeply you breathe, how your body uses the food and energy you consume, body temperature, muscle strength, menstrual cycles, and cholesterol levels. So much, so much. The brain hormonal connection. Without getting too deep into the neurology, this is a fascinating thing that I want to cover. I spoke of immediate control in the body being part of the nervous system. Your brain and spinal cord, then out to all the peripheral nerves. Then the slower process of controlling through chemical messengers, the hormones, regulated by the endocrine system. The interesting thing about the thyroid is there is a split or line of transition where the nervous system stimulates the hormonal control of the endocrine system, and right there is where the thyroid is controlled. So it's really this juncture of these 2 control systems in our body. The thyroid sits right there at a really pivotal space. So all you need to know is the pituitary gland is the gland that literally hangs from the bottom of the brain, just dangles right there. Looks like 2 cherries put together. There's a front part and a back part called anterior and posterior. So it's just hanging there. And that pituitary gland is connected to the hypothalamus, floor of the brain, and it connects to the excreting functions that push out a signal to the rest of your endocrine system. So think of the pituitary gland as the conductor. They're in front of the orchestra. And the orchestra is filled with the different glands that actually secrete hormones. Insulin is made by your pancreas, thyroid hormone by the thyroid itself, many glandular tissues throughout our digestive tract, but all of them are watching the pituitary, and the pituitary is telling the orchestra when to do its work. So when you have your thyroid level checked, most commonly the first thing they look at every time is the thyroid stimulating hormone, or TSH. I don't want to go too in-depth here, but I just want to let you know, even though it has thyroid in the name, that hormone doesn't come from the thyroid. It's actually what stimulates the thyroid to do its job. So if a provider looks at your thyroid stimulating hormone, they can determine if the pituitary is sending a strong signal or a weak signal out. And there's a bit of sleuth work that needs to be done if there's a change here. If the thyroid stimulating hormone is high, it means that that pituitary is reminding the thyroid all the time, hey, get to work. We need more. We need more. If there's a resistance in that, and the thyroid can't quite keep up, that stimulating hormone level rises, okay? So it's something called an inverse relationship. If that thyroid stimulating hormone's high, doesn't mean your thyroid level's high, it actually means that stimulation process is driving really hard. Thyroid can't quite keep up. And we'll talk about a number of reasons for that, but same is true. That thyroid stimulating hormone showing up really low means there's a whole lot of thyroid hormone circulating. Think dysfunction happening with the thyroid. Maybe those processes we talked about earlier, respiration, heart rate, consumption of energy might be happening too fast for something. So that's called hyperthyroidism. thyroidism. If somebody's thyroid is just way overactive, that's hyperthyroidism. Sluggish thyroid is a term I often use, means it's slowed up a bit, or hypothyroid means it's really depressed, okay? The most common reason for extremes of hyper or hypo have to do with our immune system picking on the thyroid. So autoimmunity is one of the greatest drivers of big thyroid dysfunction. Thank you, Mark. We want to think of, there's two main types. If you've ever heard of Graves' disease, that means the thyroid's being attacked. Oftentimes, this is palpable. I can feel it very easily. Sometimes visible. The thyroid's really swollen. But these individuals will be burning energy so fast they can't keep weight on. They will be anxious, like almost panic attack levels at times, levels of anxiety, shaking. This is Graves' disease, and it has to do with the immune system attacking the thyroid itself. The other type of thyroid issue that can be caused by the immune system dysfunction is called Hashimoto's thyroiditis, and this is the most common cause of hypothyroidism. This is where it's a different area that's attacked, so it's a different target tissue, but in both Graves and Hashimoto's, the thyroid is the target, just different areas or sectors. So if that's the case, it's a lighter situation. The goiter means the swelling of the thyroid. So the swelling is less pronounced in that case with Hashimoto's, but it's a slow, steady process. Sometimes that's underway for years, okay? Now, how you find out about either of these definitively is by running a blood test. But it's not a basic thyroid workup where they test the thyroid stimulating hormone only. They actually have to look for the antibodies. Antibodies are what our immune system uses to attack anything that's an antigen, means a foreign invader. And if the body missignals and it decides to attack your tissue, our tissue, that is autoimmunity. Okay, so in both of these cases, Graves' disease, Hashimoto's, it will throw off thyroid function, but both have to do with improper signaling. So fixing it involves helping calm the immune system. You're going to lay a fire blanket over the immune system and let it calm down. Protect that thyroid for a bit, and then you can start fixing things. Okay. Oh, I talk about a feedback loop here. That's just a reflex management system. Our body runs on reflexes, engaging enzymes to do different things, and a feedback loop just means there's a sensor that senses the presence of something, in this case thyroid hormone, and then there's a response to that. And the inverse relationship is when it's sensed that there's low thyroid, the feedback loop, thyroid hormone, the feedback loop instigates the production of more. If there's too much, it instigates a reduction. What if the thyroid's out of balance? We talked about this. So hypothyroidism, there's weight gain, there's a slowing of metabolism in general, so not just the weight gain component, but how well your cells are detoxifying. Dr. Cooper spoke earlier about the consumption of glucose by the brain. She's absolutely right. By unit volume, it's tremendously hungry for glucose. Our brain consumes 25% of our glucose in our body. And if you think of the size of our brain, and this is a room full of big brain people, but if you think of the size of our brain, relative to the rest of our body, it's minuscule, but it consumes a quarter of the glucose. Well, I will tell you that consumption of glucose is part of what I'm talking about when I say cellular metabolism, cellular respiration, and it is greatly slowed when the thyroid is hypo. And it's ramped up and running too fast, like the idle is set 2,000 RPMs too high whenever you're hyper. So neither of those extremes looks good. We want to be moderate with the thyroid, right in the middle. So thyroid blood testing, they're going to look at that thyroid stimulating hormone. And that's the standard of care. It's appropriate. But if you have a provider that's looking at that and you're saying, my friend Dan Fazio told me I need to look deeper into my thyroid, and they say, your TSH level looks fine, we don't need to do that. I'm going to ask that you get a second opinion. Because you can have a thyroid stimulating hormone level that looks all right. And that T4, remember me saying that circulates around, it's a packet for delivery, can look all right too. But if you're not in peripheral conversion and getting the active stuff, what really drives the function in the body, those normal lab values don't mean anything. What means the most is, what does the patient feel? What do you feel in your body? And if things are sluggish or ramped up too much, look deeper.
What kind of deeper test would you look for?
So when we're talking about the thyroid, you want to actually see T4, thyroid stimulating hormone, your T3 level, and there's something called, gets interesting here, reverse T3. The body shunts things over here into a intermediate metabolite, and then it reconverts it. So we want to know, if you don't have enough T3, where's it going? And often it goes to reverse T3, and then you want to have auto antibodies also. In other words, I call this, as a functional medicine doctor, a complete workup. If a patient comes in and says, they've already tested my thyroid, I just kindly say, would you mind bringing that in so I can take a look at it? I don't throw the other provider under the bus. They started in the right spot. But if they're calling that a full workup, we're going to get you a full workup. So we start by looking at those things that's valuable, but then we add things on. Okay, details. So thyroxine is what the technical term for T4. Triiodine is T3. Thank you. Let's go. Thyroid blood testing. Here we go. So here's the two different things we look for if there's autoimmunity. TPO antibodies stands, that's actually what we're looking for in the case of Hashimoto's thyroiditis. In other words, drives your thyroid function too low. Whereas TSI can detect if that Graves' disease is there. So those are just different antibodies that we're looking for. Is it this or is it this? Which category of autoimmunity? And if it's necessary to have it imaged, again, like I said, the neat thing about this is you can actually palpate, you can touch the thyroid gland. You can't do that easily with your pancreas or the liver or the other endocrine system. So you can get a hands-on feel for this, and it's great. But often imaging is helpful if there is substantial dysfunction, and an ultrasound is how they do that. And then if there's severe dysfunction suspected, what they do is they attach a little radioactive isotope to iodine, because the thyroid's going to eat up that iodine, introduce that iodine, and then that will image the thyroid. Okay, so your provider will look for swelling or lumps there, changes in hair, skin, or reflexes. All these things are because if you go hypo, there are change-ups. I want to get to questions, because there's always questions about the
We have
thyroid.
5 minutes for questions, starting now.
Thank you. You're in a tight ship. Kara, would you give one timeout for me? All right, let's talk about, we're going to end up covering most of what I have here, so please.
Is it question time?
It's question time. There we go.
Is iodine an effective supplement for thyroid or something like that?
I love it.
Thyroid gland or?
Thank you, Matt. Yes, that's my hypnotherapist talking to me. So he's not dealing with my subconscious right now, but he's talking to my conscious. I give him access to the subconscious, and he's brave enough to go in there. Okay, so things we have to know. The thyroid
Pleasant place to be.
I'm gonna answer a few things at once here because this is a great question. There are nutrients that are so important for our thyroid. Okay? We can't take a cookie cutter approach to it and say, I want everybody taking these, because there truly is an optimal amount. Okay? With vitamin C or B12, I can tell you all to take more of that. And nothing's gonna, if you're taking some already and you double it, nothing bad's gonna happen if you get too much. It's water soluble, you excrete both those things I mentioned. For the thyroid, what I'm gonna tell you about is iodine, because we know, you were paying attention, those molecules, T4 and T3, are 3 or 4 iodine molecules. But if you pour iodine in your body for use by the thyroid and there's dysfunction that's present, it's like throwing gasoline on the fire. So iodine is absolutely crucial for thyroid function, but we need to make sure that there's not different types of dysfunction present before we do that. And let me tell you the other two of the greatest hits for the thyroid. Tyrosine is an amino acid that we all get from consuming protein-rich foods. Poultry, salmon, red meat, all have this in plentiful amounts, and then certain nuts, Brazil nuts, almonds are good sources also. So tyrosine is crucial because the thyroid uses that, attaches iodine in there, and there's some enzymes, and then it becomes functional. Iodine, and then the third compound is selenium. And selenium is absolutely crucial. But excess selenium causes problems. Oddly enough, some of the same problems that hypothyroid causes. And deficient selenium, problematic too. So in other words, phone a friend on this one. I'll be your friend. There are lots of great providers doing this work, but you want somebody who specializes in functional medicine and a deeper look at the thyroid. Or if someone's an endocrinologist, they have deep knowing here. We have 2 more minutes for questions.
So I just want to clarify that last point. So what you're saying is we need to find the optimal level of tyrosine and selenium as something, a supplement that you take?
Yes,
And what is that?
Tyrosine, Tyrosine, is an amino acid.
Right, I mean, what amount is what I'm saying.
Oh, that varies for the individual depending on how much you have on board. So that this is I don't do a recommended daily allowance on this one because it may not be the
Okay.
same for you and me.
Yeah.
But again, to recap, tyrosine, we get that. The best way to get that is by properly digesting our proteins we're already eating, right? You very rarely need to be taking that as a pill outside the body, but make sure your digestive enzymes in your body are functioning properly. And what I'm saying there is, under stress, none of us produce enzymatic activity. If our body's under stress, it's not thinking about resting and digesting, right? You're in fight or flight. So that's where I use digestive enzymes. I've had it asked, oh, my gosh, you have 10,000 supplements here. I don't have that many, but I have about 7,000 How do you keep track of all this? And I will tell people, I can easily tell you the number one thing I would keep in my practice if I had nothing else, and it would be digestive enzyme support that also gets hydrochloric acid levels proper, because that's how you get the nutrition out of the food you're already consuming. So I really want to drive that home, especially for that tyrosine piece we talked about. I bet, unless someone's an extreme vegetarian or has an extreme dietary practice, you're getting enough tyrosine in the food you're consuming. Whether or not it's getting into your cells is the question, and digestive enzymatic activity and hydrochloric acid levels being optimal are the important constituents there. Yes, please.
How does chronic pain affect the thyroid?
Oh my gosh, that's a wonderful question. Because pain sensing in the body has to do with that junction of the nervous system and the endocrine system, and pain mitigation and control in the body is very dependent on our hormones, including cortisol and some other compounds. There's a very direct relationship between chronic pain states and changes in the function of the thyroid. To get into more detail, we would have to talk about a lot of different subdivisions within that, but I will just, with a capital exclamation and everything behind it, I will let you know that it is a very direct driver of thyroid changes. Yes.
What are your thoughts about the role of mind-body medicine on this topic?
Incredibly important. That, in chiropractic school, one of the things that caught my interest early on through a magnificent professor that's there at Logan was a field known as psychoneuroimmunology. When I first heard psychoneuroimmunology, it really caught my interest. I already had a degree in psychology before that, and then this neuroendocrinology. Wait a second, these are different areas of the body. How does this work? Through practices of understanding how integration happens in the body, there's a very direct relationship in how we manage stress, in how our hormonal systems can respond to that, and how the nutrition is utilized by our body in states of stress versus states of relaxation, and how we balance that. Mind-body connection is probably the most important factor in helping to balance that sympathetic nervous system. You've heard me talk on that before. That's your fight or flight. Let's get to work. Let's mobilize energy so I can get to safety. Or parasympathetic. And I do it like this because they're both always active. They just go dominant on one side or another. And parasympathetic dominance is for resting and digesting. And sympathetic dominance is for fighting and flighting. But the fight or flight component can be activated by balancing the checkbook if I don't have enough in there at the end of the
By
month.
the way, you're a fabulous educator.
Oh, thank you.
Sure.
Thank you so much. Thanks for the attention, everybody.